generally we start perineal massage around 34 weeks of pregnancy. And so what we're trying to do is prep the perineal tissue, which is the muscle tissue between the vaginal canal and the rectum. It's this space right in through here. And we're trying to prep this tissue for birth. And so one way that we can prep is to gently stretch the tissue. So how I recommend and how I guide people to do this within the clinic is that you can be either position-wise in a semi-reclined position in your bed with lots of pillows supporting your legs in a butterfly position. You could also be semi-reclined in a tub. If lying down doesn't feel good for your body, you can be in a more of a Captain Morgan position, which would be like this type of position, just the step not so high. You could also be just sitting on the toilet, or you could be in a semi-squatted position, for example, in your shower. And so when we're doing this, if you're coming from the front, if your hand is reaching from the front, you would be using your thumb to reach that muscle tissue. If your hand is coming from behind, you would be using 2 fingers to reach that vaginal space. There are also tools that we can use if it's really difficult for you to personally reach that space, or if you don't feel comfortable having your partner assist you. So what we can do then is you would be inserting your 2 fingers or your thumb into the vaginal space. So generally I recommend that you insert to about your first knuckle, a little bit past that, and you're gonna be placing pressure until you feel a stretch. And that stretch should not be painful. So I like to give pain colors from green, yellow to red. We don't want to have red pain. We want to be able to breathe and relax and learn how to reduce tension in our tissue. So you apply pressure until you feel a yellowy sensation, and then you breathe into that stretch. Then you come down to 6 o'clock and you press until you feel yellow. You breathe until it's green. And then you come over to the other side and you press until it's yellow. You breathe until it's green. From there, you can start to do a U-shaped sliding motion where you slide back and forth into that tissue, keeping it in the yellow zone and then working on it till it's green. If you have a place that feels a little bit more sticky or stiff, you kind of hang out in that space and breathe to reduce that tension. Our goal is that we're learning how our breath can reduce tension and how we can gently open up that muscle tissue and connect you into that space. It is not to cause pain, it is to help you learn how to release tension in your pelvic floor.